Good afternoon, everybody. I believe our webinar is now broadcasting to all participants. My name is Alex Bernardi, and I am joined here by Bevan Croft, the co-director of NCAPS. We're just about to get started with this slide presentation, but we are going to take just 1 minute to make sure that those who are logging in via the Zoom platform are able to make sure that they're getting to where they want to be and that they're getting their audio and video set up. So thank you all for joining us. We have a fabulous webinar that's about to get started, and we'll get started in just about 30 seconds. We'll be going over this in just a couple minutes, but as people can see, there is a chat feature that is open. If people have questions as they're getting logged in, feel free to use the chat feature as well to get started with our chat through the NCAPS webinar. So we are going to get started now in the interest of time. Again, good afternoon, where we are. My name is Alex Bernardi. I'm joined here by Bevan Croft, who will be coming into the screen in just a second. There we are. And today's webinar is focused on this is the second in a 4-part webinar series on cultural competence, what it means for person-centered thinking, planning, and practice. This webinar is sponsored by the National Center on Advancing Person-Centered Practices and Systems, which is funded by the Administration for Community Living and Centers for Medicare and Medicaid Services. We're delighted to have the guests that are with us today. And as many of you know, these webinars obviously are free, open to the public, and they will be recorded. The goal of the National Center for Advancing Person-Centered Practices and Systems, which we will refer to as NCAPS, is to promote systems change that makes person-centered principles not an aspiration, but really a reality in the lives of people across the lifespan. And this is going to be one webinar of many that addresses broad aspects. I'm going to turn it over now to Bevan, who's going to go over some of the logistics for this webinar.
Yes, hello everyone. So as with all NCAPS webinars, using the Zoom platform, all participants are muted. There are many participants, so we must use mute so that people can hear our wonderful presenters. However, you are encouraged to use the chat feature to post questions, to communicate with us, with the panelists, and even with each other. When you chat, please be sure you are chatting to all panelists and attendees if it's a question you want to pose out to the whole community, which we encourage. If you'd like to just pose a question to the panelists or to the organizers, especially if it's like a technical question, you can select to all panelists in the drop-down box instead, and we will get you some support. We will have about 15 minutes, hopefully, at the end of the presentation today for Q&A. And if there are a lot of questions that we don't get to, we'll also work with the presenters to create some written responses to questions the way that we have in the past. As with all other Zoom NCAPS webinars, this webinar is currently being live captioned in English, which you can access on this Zoom platform, and also it is being live captioned in Spanish for folks who'd like to read along to the webinar in Spanish language. And to access that, just click on the link on your screen, and you'll open up a separate window that will live caption everything for you in Spanish. There are also polls and evaluation questions that will be popping up for you to interact with us during the webinar and at the end of the webinar. So do be sure to stay till the end so that you can give us your feedback and 7 questions. Our project coordinator, Connor, will also be copying and pasting all of these logistics into chat every now and then. So you can also get the links that are up here on your screen in your chat, but in the chat box as well. Connor will also post a link there to the PDF slides which you can grab from the internet right now if you'd like to have them in front of you while we do the webinar. So you can follow along with the PDF there as well. So I will now be turning things over to our incredibly exciting panelists. We have 5 amazing women representing a range of programs and experiences here with us for the next hour plus. Our first presenter is Professor Tawara Good. She's director of the Georgetown University Center for Excellence in Developmental Disabilities. After that, we'll hear from Diana Autan. She is co-director of the SPAN Parent Advocacy Network, New Jersey's One Stop for Families, and the FV Leadership in Family Professional Partnerships. Then we'll hear from Christy Carter. She is the Older Adult Program Coordinator at the Milwaukee LGBT Community Center. Next, Brenda Liz Munoz, who is an executive committee member with the Georgia Council on Developmental Disabilities and a community services specialist in the Center for Leadership and Disability at Georgia State University. And finally, we'll hear from Lorraine Davis, who's a member of the Sisseton Wahpeton Sioux tribe and founder and executive director of the Native American Development Center, a Native American governed nonprofit located in Bismarck, North Dakota. So a warm welcome to all of our panelists. And now I will turn things over to Tawara.
Thank you. We're very excited to be with you this afternoon for this webinar series. And I understand there are quite a few registrants for this, and that makes it even more exciting that this message is getting out. So again, our theme is cultural competence, what it means for person-centered thinking, planning, and practice. Next slide. So this is what we're going to do together this afternoon. I will describe a framework for cultural competence, both at the individual and organizational levels. We will hear from our panelists who will provide real-life examples of an organization that values and practices cultural competence. We'll highlight personal narratives of individuals who will share what culturally competent services mean to them and their families. And we will describe how cultural competence and person-centered thinking and practice are integrally linked. So I thought that we would start with a refresher. We had one webinar that was also well attended that really looked at culture. And we thought we would have just a quick refresher on culture before we define cultural competence. I mean, we really can't talk about what is cultural competence without at least a shared understanding of culture. So, quickly, culture influences every aspect of life, and it defines who we are as human beings. Culture is learned and shared knowledge about our own values and life and that of others. It includes our norms and moral practices, beliefs, customs. It includes ceremonies and rituals and language and much, much more. We all have multiple cultural identities. So that means we're not just one thing. Next slide. Culture remains the same, and yet it is dynamic. And so that we know that there are aspects of culture that are passed down from generation to generation, whereas there are other aspects of culture that are dynamic and constantly changing. And as I think of technology and what technology has done for us and the changes that it's made, that would be a really good example of something that's quite dynamic, that is constantly changing. Even getting used to this Zoom platform, having an opportunity to see all of the presenters and just setting up for this, again, was a cultural experience. A lot of times we really see things from our own worldview, and that's how we understand the world. And it's really our own specific cultural perspective. Because of this, it often makes things very difficult to view and understand cultures that may be different than our own. And lastly, programs, organizations, and systems of services and supports are all culturally defined, meaning that they're really designed for individuals with disabilities mental health needs, including those who are aging, so that each program or organization or system is indeed culturally defined, and within that has multiple subcultures. Next slide. So this is one of several polling questions we'll ask for you to complete. And this question really is asking whether or not your organization, your agency or program has reached a consensus for an operational definition of cultural competence. That's your responses. Another question is cultural competence a required area of knowledge and skills in the position description? And the last question will pop up on the screen. It's a little obscured from my view. So I'd love for you to go ahead and make your responses, please. Okay. You should let me know when you want the polling to end. I can't see the progress from my position. Okay, so we're waiting for the screen to come up that will show the results. Ah, great. So hopefully everyone can see these results. 28% of individuals said that their organization have indeed reached a definition and consensus on what is cultural competence. 21% said no. 26% said in progress, and 24% said don't know. Thank you for responding to this. And then is cultural competence required area of knowledge and or a skill set and position descriptions? So we see 41% of individuals said yes, 31% no, 13% in progress, and 15% don't know. And there should be one more question.
If you scroll down, I think you will be able to see that third question.
Alrighty. Sorry. All right. So is cultural competence assessed in staff and annual performance reviews? 19% said no, said yes, I'm sorry. 50% said no, 11% said in progress, and 20% said don't know. So again, I think that this webinar will help us really think about these things from a systemic approach. So we'll close the polling. All right. So in the literature, we see many definitions of cultural competence, and we see many terms. And I suggest to you that they are all mean something different. So when we see culturally aware, cultural responsiveness, culturally effective, culturally relevant, I suggest to you that they all mean something different. And oftentimes people may talk about cultural competence, and if we listen really very carefully, maybe they really are speaking more about cultural sensitivity or cultural awareness. So we're going to share with you a framework for thinking about cultural competence. Next slide, please. Many in health, mental health, disability, and social services that include aging have a lot to say about cultural competence. Things like it's something we have to give lip service to. It's really simply a passing trend. We do not have enough resources to devote to this. There is not enough time. Is this really still a thing? It is not part of my former academic training. One of my personal favorites is, isn't there an app for that? And doesn't diversity and inclusion office take care of all of that? already took that workshop? And is there really any evidence? And so these are all things that we've heard across the country when we're conducting training, which tells us many things about how people understand cultural competence. Next slide. Next slide, please. The Developmental Disabilities Bill of Rights Act does indeed define cultural competence, as you see here. And again, I think it is a great definition. It's been around since 2000. I think some people don't know it actually exists. As I look at this framework for thinking about cultural competence, the focus is really on individuals being able to participate to their maximum ability, and that the services are designed in a way that would be reflective of their cultures, their attitudes, their values, and their interpersonal styles. This definition gives us a great way of thinking about cultural competence. So what I'll share with you is really looking at how is it implemented within the organization. Next slide, please. This is from the work of Terry Cross, Barbara Bazeron, Carl Dennis, Marisa Isaacs, and James Mason. And they did a framework for cultural competence back in 1989. And I would say that this framework has remained pretty much constant, some adaptations, and has been adapted by many. And I think that is not by coincidence. Now, while this framework was originally, conceptual framework was originally created for children's mental health, it certainly has been adapted across many systems of services and support. So in this framework, we're saying that cultural competence indeed has to have clearly defined and congruent values and principles. So in other words, you can't state a value, but your policies don't align with it. And so again, there must be policies in place, structures, practices. We'd see specific behaviors and attitudes among the staff within that organization that will enable them to work effectively cross-culturally, not cross-racially or cross-ethnically, but cross-culturally in a very broad way. We spoke about culture earlier. Next slide. There are 5 elements of cultural competence at the individual level. We need to be able to acknowledge cultural differences, which in this environment is often very difficult. To understand your own culture, it's difficult to really talk about understanding the culture of others when you don't have a clear understanding of your own cultures, and I dare say your multiple cultural identities. Being able to engage in self-assessment, and this doesn't always refer to a tool. It can be an opportunity for self-reflection, so that say Diana and I had an exchange and it didn't go well, that I am able to go back and really reflect to say, you know, were there cultural issues, were there communication barriers in that exchange? The 4th element is being able to acquire cultural knowledge and skills. And this basically says that cultural competence is intentional. It doesn't happen by osmosis. And it doesn't happen because there's a workshop or that there's one webinar. This is work that is ongoing. And we continue to acquire cultural knowledge and skills over time. Lastly, we have to, at the individual level, be able to view behavior within a cultural context. So no matter how odd a behavior may be, there's indeed an underlying cultural rationale and reason for it. Our job is to find that out. Next slide. At the organizational level, when we think about cultural competence, organizations must be able to value diversity, and that would be the broad range of diversity, not limited to race and ethnicity. They also must be able to conduct self-assessment, and that means to be able to look at themselves as an organization in a very objective way. Sometimes you can use tools or instruments. Sometimes you can just have review. And part of that self-assessment process, which is really key and critical, is to really engage individuals who are recipients of services and supports. The next is being able to manage the dynamics of difference. And this difference would mean, again, not just looking at the differences between individuals seeking services and the staff. This is looking at community dynamics. This is looking at partners. This is looking at individuals that you may serve in a very discrete way in terms of how do you support those individuals to receive services and support that are of interest and appropriate for them. The next is being able to embed or institutionalize cultural knowledge. The regional framework uses the word institutionalized. It has significant meaning when we think of mental health and also disabilities. We modified it to say embed. So this looks at embedding cultural knowledge throughout the organization. Oftentimes there's maybe one or two people who may have specific areas of knowledge and skills. They're often called upon as the cultural competence experts or the diversity experts, with not sharing that responsibility throughout the organization. So again, the capacity to embed cultural knowledge. And lastly, we have to adapt to diversity because things change. Rules change, neighborhoods change, staff change, and we have to continue to go back and revisit this over time. Next slide, please. Cultural competence have to be at all levels of an agency, organization, or program. I would say that the literature shows us a lot in the area of practice and service delivery. However, I say that there has to be a home for culturally competent practice. And so that means that it has to be at the administrative level, the policymaking level, the administrative level, practice and service level for individuals and families, and also at the community level. And I would say it is very difficult to be a culturally competent, I'll just say nurse, social worker, or teacher in an organization that does not support you with policies, procedures overall. So all of these levels must be impacted if we're looking at cultural competence, again, at an organization, system, or agency level. Cultural competence occurs along a continuum, as you see here, that I think that it's not important for us to label an organization culturally competent or not. If we look at it as a developmental process that occurs over time, that organizations and programs may be very competent with serving a particular population and still gaining some of the expertise to serve other populations. So it's important to be able to use this as a gauge. You can find descriptors on our website. I would say that many disability service systems in particular use an approach of, I would say cultural blindness, and blindness is used in the original, in the user framework, and that we treat everyone the same. We want to make sure that everyone gets things on an equal basis. Again, you would not treat a 4-year-old as the same as you treat a 40-year-old, so that we know that we have to indeed make specific adaptations for individuals. Next slide. These are characteristics of culturally and linguistically competent organizations. I'm not going to go through great detail. We'll be able to map this toward the end of the webinar, but there has to be a philosophical underpinning and buy-in that cultural competence is indeed important. Indeed, it has to be within the mission statement, policies, structures, procedures, and practices. And Diana Upton will talk a lot more about this, but again, it has to be woven throughout the organization, not only in person-centered planning. Next slide. So if we think about cultural and linguistic competence in the key considerations, I want you to just think about this. What do you do? How does cultural competence relate to your core functions? How does it relate to who you are as an organization, including resources and staff development? It also relates to who your partners are in terms of collaboration and community engagement. It is extremely important to where the money goes, how you allocate fiscal resources. We hear this a lot in terms of we just don't have money for that. And again, it's looking at how do you ensure that resources are dedicated to this. And lastly, when you look at the contracts, who you're contracting with, they're acting on your behalf. And so you have to really look at key considerations for cultural competence in terms of who do you trust to deliver services and supports on your behalf. So that was a quick overview of cultural competence. We have another polling question, round 2. So it's asking, in your organization, agency, or program, do staff have a shared understanding of cultural competence and its role in services and supports? Second question is, what about contractors? And what about clients, consumers, and families? What about the communities that are served? And is there a firm commitment among leadership and staff to advance and sustain cultural competence? Please take time to respond to those questions.
Okay, it looks like most people have entered that they're finished, so we can close that, and Connor's sharing the results.
All right, so the results are there. In terms of only half of the people, or a little less than half of people, said that there's a shared understanding of cultural competence within their programs. And then when we look at what about their contractors, again, we see that 26% are saying no, and 44% are saying they really don't know. And what about clients, consumers, and families? 20% is saying no, 29% is saying no, 22% in progress, and 29% don't know. What about communities served? All right, these are pretty revealing responses, and I thank you for being honest and sharing those with us. And is there a firm commitment among leadership? So yes, 53%, 13% is no, 24% in progress, and 10% don't know. All right, so we have a lot of work to do. We have to roll up our sleeves. So we're now are going to hear from our speakers, and I've given prompt questions to Diana, to Lorraine, to Brenda Lees, and to Christy. And again, this should be absolutely amazing. And so I am unsure who we're starting with, and I will ask Alex or someone to give me a heads up as to who starts first.
We will be starting with Diana, and I'll be moving to Diana's slides. Diana, you can let me know how you'd like to move through them as well.
Thank you.
Okay. Oh, I'm going to move to polling question round 3. Do we have one more question that we need to do?
No. This is my summary. These are my summary slides.
Okay.
So you got to get to Diana's slides.
Okay. Maybe we skip past. Hang on a second, everyone. Sorry about that.
No worries, Alex.
Here you go, Diana.
Great, thank you. Welcome, everybody. I'm Diana Autain. I'm the co-director at the SPAN Parent Advocacy Network in New Jersey. We are a family-led organization that serves as the Parent Training Information Center, the Family to Family Health Information Center, the Federation of Families for Children's Mental Health, as well as the Parent to Parent USA state affiliate for New Jersey. And we provide support and advocacy on behalf of families of children, youth, and young adults birth to 26. I'm also a parent myself of a diverse group of adopted children that have a range of strengths and challenges and come from a range of diverse backgrounds. And I myself am Cajun and also Native American from Bayou Lafourche in Golden Meadow, Louisiana. Next slide. SPAN's vision and mission includes an explicit commitment to the children and families who face the greatest challenges. You can see here that we talk about the children and families with the greatest needs due to disability or special health, mental health needs, poverty, discrimination, race, ethnicity, gender, language, immigrant or homeless status, involvement in the child welfare or juvenile justice systems, geographic location, or other special circumstances. And as I go through my slides, I'll be taking the crosswalk that Tawara developed crosswalking between person-centeredness and cultural competence, and trying to share just a little bit about how SPAN seeks to demonstrate the commitment to both person-centeredness and cultural competence. And here is where I'm talking about valuing diversity, responsive policies, and practices. Next slide. In our strategic plan, we have identified the values of diversity, equity, inclusiveness, self-efficacy, collaboration, engagement, fearlessness, community, and high standards. And all of these really relate both to person-centeredness and cultural linguistic competence. And even in the specific goals of our strategic plan, we explicitly focus on ensuring that we are working with and supporting and engaging and building the leadership of diverse parents, families, and professionals, that we have family and children at the center, that we are developing and using training and tools that are culturally attuned to diverse populations, etc. We are explicit in our strategic plan, both in terms of our values and our goals. Next slide. In terms of valuing diversity and having a diverse representative staff, SPAN staff, and here's a picture of our staff, includes over 60% parents of color. Our staff speak 9 languages. We have parents from every part of the state and over a dozen countries of origin. We have men and women, not enough men, staff of all religions, including no religion, all socioeconomic and educational statuses, birth parents, foster parents, adoptive parents. And this diversity exists not only in our line staff, but also in our project directors and our management team, and also our board of directors. And this diversity in our staff and leadership keeps us honest and focused on combating discrimination and all the isms, as well as focused on family and person-centered planning and practices. And we explicitly have language in our job descriptions, in our advertising and recruitment, in our employment and affirmative action, hiring and promotion policies, et cetera, that demonstrate our commitment to having this diverse representative staff, as well as parent leaders and volunteers. So we recruit our volunteers and parent leaders from underserved communities and work to ensure that families that represent the children and families that have the poorest outcomes are prominently featured as leaders in the work that we do. In our organizational assessment, we periodically do the National Center for Cultural Competence, Cultural and Linguistic Competence self-assessment for family organizations with our staff and board. We annually update our language access assessment and plan. Every 3 to 5 years when we prepare for our strategic planning process, we also complete the Family-Centered Services self-assessment for parent centers, which addresses both cultural and linguistic competence and family and person-centered policies, practices, and procedures, as well as the individual self-assessment for core competencies for trauma-informed staff and elements of trauma-informed environment self-assessment. Next slide. We also ensure that our organizational assessment includes assessment by the constituents that we seek to engage and serve. So we conduct surveys and callbacks and focus groups of families from diverse backgrounds regarding the impact of our work. On an ongoing basis, we review our data to identify how effectively we have served diverse groups, looking at both qualitative and quantitative data. We survey or call back diverse families served by each of our family resource specialists and our trainers. And if we find any concerns, we immediately address it with the appropriate staff person. Next slide. In seeking to manage the dynamics of difference, we prepare and support our staff to communicate and interact effectively with families and each other. So in our initial and ongoing staff and volunteer development, we have explicit professional development for working with underserved families, working with families that speak languages other than English, training on cultural competence, as well as training on becoming a more trauma-informed organization within a diverse cultural context. All of our staff and volunteers go through this 6-session SPAN resource parent training that focuses on these priorities. We also have quarterly all-staff meetings with embedded staff development. For example, the most recently quarterly all-staff meeting had 3 of our immigrant staff from diverse countries of origin who did a presentation around the challenges that are faced by immigrant families, particularly in this challenging environment. We also do weekly calls with all of our staff, providing individual assistance, where we frequently highlight cultural and language issues and family and person-centeredness. We work with our Department of Health and our statewide network for cultural competence on an annual statewide cultural competence conference, where many staff both present and attend. And we also have an explicit focus on this in our annual performance reviews, including in our review rubrics. Next slide. SPAN strongly believes that you can only practice person-centered planning if you practice cultural competency, and also that you can really only practice cultural competency with your heart. Some of our guiding principles that we share with our staff and volunteers include: do unto others as they would have you do unto them. Seek first to understand and then to be understood. And it is only with the heart that one can see clearly. What is essential is invisible to the eye. Next slide. Our hiring policies and practices result in staff, volunteers, and leaders who are primarily diverse parents and young adults with lived experience of all of the isms and of systems that are not family or person-centered. Our initial and ongoing preparation and support of staff and volunteers is focused on ensuring respect for and viewing our constituents as experts in their own lives, entitled to quality of life, well-being, and informed choice, which of course is person-centered thinking. And all of that is influenced by culture and language. Cultural competence and person-centeredness are both about building relationships. It's not just about learning about the other, but also about sharing oneself and building trust. And you know, Tuara talked about understanding your own cultural background and beliefs and values, and that's so critical to both person-centered work and cultural competence. And we have a significant focus on active and empathetic and empathic listening, listening with the heart for the heart. Next slide. To embed cultural knowledge, it's critical that we make sure that our staff accept and adhere to those explicit expectations that we set. So we set clear expectations and clear communication about those expectations and what needs to be done to meet the expectations to lead to a clear outcome, an organization and a workplace, a presence in the community with our partners, with state and other agencies, and with families that welcomes and supports everyone, regardless of any characteristics that in other environments would mean that they would face discrimination and those isms. Next slide. We keep abreast of the demographics of the community that we serve, so we revisit our language access plan every year and conduct a language access self-assessment every 3 years. Language demographics is a key component of these processes. We review the community demographics of our state and the 3 regions of our state and our 21 counties on an ongoing basis. And as Tuara talked about before, as an organization, you can have a great capacity to serve a particular language community or immigrant community or a community with a particular type of disability or special health care need, and yet not be competent in serving other constituencies. So it's really critical to keep abreast of those demographics and make sure that you're measuring things like the diversity of your board and your staff and your volunteers and your parent leaders in comparison to the composition of the relevant populations in our catchment areas, and also to the most underserved families, that is, those who are facing the greatest disparities and the poorest outcomes. Next slide. So on an ongoing basis, we review our data to identify who did we serve. Is it representative of our state? And again, we look in a lot of different categories. We measure that representative and diversity of our families served overall with individual assistance, with training, leadership development, support groups, community doulas, families provided with more intensive support, and report out on those demographics, which helps ensure that our staff are aware of the importance to our organization of equitably serving all groups and individuals. I'm just going to show you a couple of, next slide. So one of the things that we measure on an ongoing basis is are we serving families in every county? And so this, the blue is the families that we served in our most recent chart versus population by county. And if you look at the counties like that have the highest blue, like Essex and Union, these are counties that have some of the poorest families, some of the most diverse families, African American and immigrant families, families that don't speak English, families that face the poorest outcomes. And so it's not just making sure that we have an exactly equal amount, but are we really highlighting those communities where families need us the most? The next slide, you can see our families served by race last year. Actually, the majority by race were African American, and you can see the other groups. In fact, for non-white populations, we overserved. In other words, we served a higher proportion of Asian families, et cetera, than are in the overall population. And then by ethnicity, about a quarter of the families that we served were Hispanic or Latino, which also is higher than the Latino population. The next slide, here's a picture of our New Jersey Yale Youth Advisor Group showing the diversity in that group. And then the last slide, which is some of our parent leadership pictures showing the diversity among the family leaders. I think in closing, just want to say that all human beings, including those with intellectual and developmental disabilities, are shaped and influenced by our cultural and linguistic backgrounds. And so SPAN strongly believes that it's only possible to engage in person-centered thinking and to be person-centered if one also engages in culturally and linguistically competent and appropriate practices. Thanks very much.
Thank you very much, Diana. I really appreciate all that you've shared. Next, we have Christy Carter, who is coming up next. And I'm going to pass it over to you, Christy, to share. And I know you had some questions that you were going to respond to.
Carter. I'm the Older Adult Program Coordinator at the Milwaukee LGBT Center in Milwaukee, Wisconsin. So I'm going to take it from a different perspective. Just so everybody knows, I am in both these communities. I have a physical disability, I have cerebral palsy, and I also am a member of the LGBT community myself. So when I was looking at how to structure this, I wanted to go first by talking about person-centered thinking and relate it to me. So I use personal care to get up every day so I can go to work and do things I need to do and be independent. And because I work full-time and also need this, I don't really fit the mold of some of these systems that help people with disabilities. And so when I work with my clients that are also from the LGBT community and older adults, I find that some of the things that I struggle with are also some things that they struggle with, basically because of their physical limitations of aging and because of the different family structures that exist if you're LGBT, because most of the older adults may not have older adult children to take care of them once they're aging. And specifically in nursing home systems, when their family structure is different, they might not have family members that can come and check and make sure that things are being handled the way they should be. I also personally, I'm from Illinois originally, but live in Wisconsin. So my family, although they are here, are not here to provide care and assistance for me. As far as person-centered planning, in Wisconsin, it's becoming more of an option for people, elderly and those that are of all ages with disabilities, like IRIS, which is a care practice where people can decide basically where their funding goes. This is a great idea, but it doesn't always work for people because of personal needs or their lifestyle. There's different, maybe different income limits, or based on the salary that like I get, it's hard to figure out what my copay would be. As far as this regarding the clients that I serve, Again, there's still a learning curve when dealing with older adults in the LGBT community related to healthcare because of education or maybe microaggressions that and things that have happened to the older adults that I worked with in the past. But we are moving forward. One of the main things that I'm working with to start within our community center is to work with an ombudsman, specifically works with LGBT folks who have difficulties in once they're in long-term care facilities. As far as person-centered practices go, I personally have always been my own advocate. My mom and dad were always like, Christy, you're fighting a cause. And that has always been and is something that I've done, and I take that within the work that I do. As far as the clients that I serve, we provide a lot of social and educational activities so that they can be around their family. And like I said, it doesn't have to be your typical family. It can be, family structures can be different. We have support groups, therapy for folks that need it, and different social events so that they can be around people and fight isolation. So. But I believe that culture, it's very important to remember that we may not know what works for everyone, and that when we're looking at cultural competency, we need to kind of broaden our horizons and remember that what works for some may not work for all. Thank you.
Thank you, Christy. I really appreciate it. Can you hear me okay?
Yeah, I can.
Great. Thank you, Christy. And thanks for bearing with us with the technical difficulty as well as we got it all sorted out. Okay, I'm going to turn us next to Bran Liz Munoz. Bran, are you there?
I am.
Well, take it away.
So, buenas tardes, good afternoon, greetings from Atlanta, Georgia. I want to actually start by giving gratitude and thanks to my national mentors, Tawara Good and Matt McCullough, and also my directors at the Center for Leadership and Disability, part of the School of Public Health at Georgia State University, Dr. Don Crimmins and Dr. Emily Graybill. So thanks and praises. I want to focus on the fact that I am the parent of a tall, dark, handsome young man who is bilingual in his receptive language and nonverbal, and lives with autism spectrum disorders. So I come to this work informed by being his parent, and the focus of our work at the Center for Leadership and Disability, I want to approach it as being person-centered, family-centered, and community-centered. In 2015, we were able to secure funding for a diversity fellowship initiative that resulted in the co-creation of our now called Latino Community Practice. And the Latino Community Practice is a diverse multi-sector consortium of professional families and allies in Georgia with 3 areas of focus: professional capacity building and collective and social impact, Latino parent education and leadership training, and formal and informal advocacy in public policy and systems of care. And some of the LCPR, the Latino Community Practice activities that are, again, person-centered, family-centered, and community-centered are, and I will actually talk about them in order. Adelanto is actually translated into Forward Autism, is a psychoeducational group that's facilitated in Spanish for and with our ever-growing Latinx community in Georgia. And it's a monthly meeting where parents can come and gather to build community, as well as receive current information on how to best navigate systems of care, to focus on how to work with an interpreter, how to build their own advocacy and leadership skills. We also have an initiative called our Autism Conference and Expo. And for the last 5 years, we have been able to provide a Spanish track where we have an annual 2-day conference for and with the Latinx community. And this includes families and professionals that is simultaneously interpreted and facilitated in Spanish with an emphasis on meaningful and relevant content for the Latinx community. And every year around the month of April and May, we draw over 25 parents who are part of the community that we serve and who are building their leadership and advocacy skills through continuous education. We also focus on bilingual community education and outreach. We collaborate with our Latino community practice partners to disseminate bilingual social marketing materials that promote healthy development. And this is inclusive of the Center for Disease Control and Prevention, CDC, here in Atlanta, and their Learn the Signs and Act Early campaign. And we also work closely with the Georgia Department of Public Health and their Habla Conmigo, which is their Talk to Me Baby campaign. We disseminate information out in the community when we are invited to educational fairs, health fairs, and we also have a monthly radio program called Salud es Vida, which is Health is Life. And for the past year, we have a full partnership with Radio Vida. It's 102.1 FM in Duluth, Georgia, where we have a live 30-minute monthly Spanish radio segment. And we focus on topics related to autism and the intersection of the Latinx community. We have this on-air program where there are recorded viewings that are posted in Facebook, and we usually have on-air questions that we also answer. We have Spanish Parent Academy and this is a partnership with the Center for Leadership and Disability and the Georgia Department of Public Health. And this aims at educating the Latinx parents on positive behavior interventions and supports. And it's delivered as 2-hour interactive workshops that meet once a week for 6 sessions. And we translate the social marketing materials, curriculum, promote the academy, recruit and register families, and I personally interpret the sessions. We are also part of this evaluation team. And just to continue mentioning some of our activities, we provide translation and interpreting. So we offer master level professional English and Spanish translation and consecutive and simultaneous interpretation. And our staff holds postgraduate certifications in both educational and healthcare and medical interpreting. So these are some of the activities under the Latino Community Practice Initiative that we have nurtured and developed and implemented for the last 4 or 5 years. And the reason why is meaningful to me is because I was born and raised in the beautiful island of Puerto Rico, and being a proud Puerto Rican and a proud Latina, I am serving my community. So this work is with and for our parents and families and individuals and communities that are near and dear to me. And I will stop there.
Well, thank you, Bram. I think you've covered such a broad range of innovative ideas and creative ideas. I've been watching the text and people, or the chat, and people have been getting really excited at some of your ideas. I'm going to turn it over quickly then to Lorraine Davis, who is our final speaker. And Lorraine, thank you for joining us. And can you hear us?
Hello, yes, hi, this is Lorraine Davis here. Yep, I can hear you.
Great, take it away, Lorraine.
Yes, hello everybody. My name is Lorraine Davis, and I am the founder and CEO of the Native American Development Center and Native Community Development, Inc., doing business as Native Inc. We are governed by a Native American board and are both co-located in Bismarck, North Dakota. I'm a proud enrolled member of the Siston-Wahpeton Sioux tribe and a descendant of the Ricra people of the 3 affiliated tribes of North Dakota. And lastly, I am Mexican American from California. I also represent a person with a lived experience of many of the socioeconomic challenges commonly facing Native Americans that we serve here in North Dakota. Native Inc.'s mission is to create a safe and inclusive Native communities within urban areas in North Dakota through affordable housing, culture, education, and services to improve quality of life for various Native American populations. Our center's person and family-centered model addresses social, cultural, and economic challenges that inhibit Native Americans' ability to improve their lives for themselves and their children. It was designed in response to the cultural dissonance that I personally experienced upon moving to Bismarck from a reservation as a single parent over 19 years ago. I'm currently working on a research project that will explore traumatic lived experiences of Native American adults living in urban areas across North Dakota. So getting to the services that we are providing and intend to provide, some of those starts with the recovery services. And in our recovery services, we are really taking the approach of addressing it through our cultural ways of connecting. So it's tribal people are serving tribal people with peer supportive services. And this is really our way of addressing intergenerational trauma. So I just, want to, make sure, and I'll talk a little bit more about that after this section of explaining our services. So I'll just wait on that until I get to that section. The other type of service that we're providing is American Indian Life Skills Development Services. And this is also to address intergenerational trauma. The third one is community-based learning to revitalize and preserve our tribal identities and our languages. Fourthly is consumer finance services to address intergenerational poverty. And also our sister organization is also providing lending services to address also intergenerational poverty. And lastly, we are currently working on a community development project involving the development of a permanent supportive housing model and inclusive of developing a cultural ecosystem. And in terms, I'm referring to creating workforce development opportunities and tribal tourism opportunities to enhance not only our tribal people, but also our economy within the state of North Dakota. Furthermore, our person-centered approach begins really with the heart of realizing and validating that Native Americans have experienced historical traumatic events, and that today we are actually working on addressing what is called intergenerational trauma. For us, it's significant. It's a lifelong commitment and process, and it will also be an intergenerational process. We're addressing this through a strength-based approach. We also realize and validate that we are tribal people regardless of geography. We know that many Native Americans live off reservations. In fact, the US Census, the last census was in 2010, and there are 78% of Native Americans living off reservations. So it's very important to understand that we still are tribal people with tribal needs, and that make us unique to other ethnical populations in understanding our history with America. Also, the philosophy of our business model is to meet people where they are, but also to be culturally responsive, which means as a provider, we must know who tribal people are in terms of their beliefs, their traditional customs, and how language is vital to their identity. And lastly, to know where they have been, to know how to serve them, and being able to actually meet them where they are. So some examples that I have and want to share about serving and meeting tribal populations' needs are really through a threefold approach, and that is social emotional. This means tribal people have the need for a sense of belonging with their tribal people. In the context of a tribal nation, this would mean a sense of belonging within their own community with their own tribal people. In the context of urban areas, this would mean tribal people have a need to be connected intertribally, regardless of tribal affiliation. There are significant testimonies that I have documented by urban Indians regarding this need, whether urban Indians are experiencing homelessness, addiction, or whether they are artists or performers, etc. Urban Indians desire to be connected with one another to feel the sense of unity and belonging. So that's a vital daily need, that social emotional need that tribal people have in urban settings. Second, I had grouped together cultural spiritual. Sometimes, for example, when you want to volunteer and do some outreach to, like, say, a prison, for example, which we do, and I've personally done, is that they want to put us in a box of religion. Native Americans never and still don't really have a religion today we have, of course, there are Native Americans, obviously, that have adopted Christianity, but what I found is that more actually adopt both ways of life. And that goes back to understanding our history and the assimilation process. But there are so many that would and really desire to obtain their own culture and way of life. So when we talk about cultural and spiritual, they really go hand in hand, because it is really just that. It's a way of life. And language is a big part of that, very significant to our identities and sense of belonging and community. So this involves our tribal value systems, our beliefs, and also our tribal customs. And this differs tribe to tribe. Every tribe is uniquely different. There are over 500 tribes in America. There are 5 different tribes right here in North Dakota. And furthermore, some tribes are similar to one another. So I believe it really just takes an understanding of the tribes, that are maybe in your specific state or even just in your local area. Knowing and realizing that Native Americans are in fact tribal people, and getting to know a little bit more of what that means is very important. Also, many of the traditional beliefs and language are very limited to public access due to fear of cultural appropriations. More and more we're starting to hear from, I know in my network of Native scholars, there is a fear of cultural appropriation. So I think it is very important for tribal organizations to be the lead in documenting their own tribe's history, language, and traditional customs, and be the deliverer of those ideologies. Third, I had grouped together is economical. So this means that our approach realizes that historically we did not utilize a monetary financial system to run our economies prior to colonization. So how we address that is our curriculums are developed and delivered by tribal entities and people. Our curriculums recognize that our history used a barter system to survive, and that's how we ran our economies. And that only works for so long until our way of life is no longer allowing us to sustain that way of life. So of course we are still in that transformation process of really adopting this monetary system. I can give you an example just personally as a Native American tribal member living off the reservation for the last 19 years. However, I've lived on the reservation many of my years of my younger adult life and in my youth. And just knowing that, even into my young adulthood and looking for housing, for example, you really can survive without understanding the credit score, typology. And so you could basically go through your life if you just stay on the reservation without having to understand credit scores and how they impact prosperity and quality of life. So for some that is just fine, but for some others, maybe they have plans to buy a home that may be off the reservation, where a career, ideal career may be. So those are just one little example of that. So it's really important to be able to have and deliver curriculum that is culturally responsive to tribal people, regardless of where they are. That pretty much wraps up my presentation. So if there's any questions, I'd be happy to answer them.
Lorraine, thank you so much for covering a really fabulous set of thought-provoking and amazing work. I'm going to, at this point, I'm going to move the slides rather quickly back to your wrap-up slides, Tawara, and then we will be able to go to Q&A for the whole panelist group. So apologies for having to pull us through really quickly, but here we are. This is the slide. We're going to turn it back to Tawara Good for a few wrap-up remarks.
Thank you. And before I start, I just have to again acknowledge the incredible work of everyone who's presented today. It's just simply amazing, and also encouraging that this work is indeed happening across our country. So if we look at NCAP's definitions of person-centered thinking, planning, and practices, it's very specific. And so that, again, it's for person-centered thinking, it's very well explained here in terms of the person being at the center and the person having the capacity and making choices and informed choices about their lives. And then if we look at person-centered planning, again, there are a set of tools and resources to help individuals engage in such a process. And then lastly, looking at person-centered practices. And this is really taking it from the perspective of, what do we do from a systems and organizational level? Next slide, please. So looking at polling round, to what extent has your in-service training or professional development on person-centered thinking and practice included content on cultural competence? This is just one question. We should get through this fairly quickly.
Another 8 or 9 seconds. There we go. It's close. We've got it.
All right. So if we look at the sometimes, if we look at the rarely, and we look at the never, and not too sure how many people actually respond, that tells us that the way some individuals, organizations, and systems are thinking about person-centered thinking, planning, and practices, it's not inclusive of culture. And when, as everyone has said, culture is who we are. It defines who we are as human beings. And so that while cultural competence has evolved, person-centeredness has evolved, and I must throw in family-centered and also community-centered, that sometimes those paths have not crossed. And so I'm going to share a crosswalk with you that was created. Next slide, please. So if we're looking at trying to align person-centered thinking, planning, and practice, these are things for you to remember. It's not just the culture of the person. It is also the culture of the individuals who are delivering services and supports. And quite frankly, it's also the culture of the organization that's also doing it. When we think of person-centered planning, it really is having the knowledge and willingness to be able to embed the multiple dimensions of culture that we talked about before in all aspects of the planning process. Otherwise, you're not really addressing culture. And then it also may mean that we have to revisit and revise some of the tools that are in existence that only minimally emphasize culture. And then when we look at person-centered practices, it's really ensuring that the values and structures, the practices and attitudes as it relates to culture are indeed, a person-centered thinking is indeed aligned with the principles and practices of cultural competence. And obviously, one of the reasons that we're doing this webinar series is to get people to think about it and to make it more closely aligned and to begin to put this within the structures of their organizations. Next slide, please. And so I did a crosswalk. It will be available in a handout that helps us to really figure out aligning person-centered thinking, planning, and practice with elements of cultural and linguistic competence. And this is looking at the individual level. So I think they're fairly self-explanatory, being attuned to both similarities and differences between and among cultural groups. Again, that's acknowledging cultural differences, and we heard those so eloquently described today. Understanding your own culture is so key, because sometimes when we're, quote, at work, is that we take on the element of the culture of the organization and or that I separate myself from the work that I do. I don't bring my whole person to it. And so you really need to examine whether or not your cultural belief systems may indeed negatively influence communication and relationships with the persons that you're serving, and whether or not your cultural beliefs and practices associated with your own discipline or professional background, how they may play out in the work that you do. And again, sometimes this is on an unconscious level. We look at self-assessment. Being able to engage in self-assessment is a routine aspect of your professional career. It's key and critical. We all need to take time to reflect. And then to identify and respond to assessment tools and checklists that may indeed help you really gauge and think about your practice of cultural competence. This one I love. It's like think culture when you think others are not behaving in ways that are consistent with your values, norms, and beliefs. And oftentimes I use images of Tina Turner in my slides. And for some folks who may not know who she is, pretty famous singer, and my son would say back in the day, and that's all right, because that's the music that I listen to. But really for you to think culture. She sang a really great song, What's Love Got to Do with It? And I encourage people to say, what's culture got to do with it? And if you ask yourself that question, you would be very, very surprised. Quickly, making a personal and professional commitment to learn about persons and groups that may be different than your own, and to translate this. So this is not just, okay, I know a little something about this particular group, but how do you translate that into knowledge and skills that be required by your position? And lastly, accept that persons from racial, ethnic, and cultural groups that have had historical experiences of discrimination, stereotyping, and when I say cultural groups, it's not racial and ethnic groups, could be LGBTQ, could be any range of groups, but that they've had experiences that affect their behavior. And I think that we don't always think about that in design of our support systems. Next slide, please. And if we think about this at an organizational level, again, the capacity to value diversity. So we heard Diana, we heard Brenda, and we also heard Lorraine really talk about that the cultural competence or responsiveness aspect of their work is not in isolation. It is embedded into the core and fabric of the organization. So again, they shared this, and I don't need to go over it. I do think that being able to conduct organizational self-assessment is key and critical to really be able to gauge where you are in terms of your own staff, your relationships with communities, and also the services and supports that you deliver to really assess, are you doing this in a way that is responsive to those diverse cultural groups? Managing the dynamics of differences. Again, it's being able to prepare and support staff at all levels of the organization in terms of how to address individuals with from culturally diverse background. And in this, I'm talking so much about culture, and I've not talked about language because our next webinar will be on linguistic competence. So it's not that I've forgotten it, but I really am focusing on the cultural aspect. They're intricately linked. So again, I think that that is really key and critical. Lastly, being able to embed cultural knowledge, that there shouldn't be one person or organization with this knowledge, and if they leave, their knowledge goes with them. But there has to be a way in which this is integrated throughout the entire aspect of a function for all of the organizations. And lastly, we heard Diana talk about this, keeping abreast of the demographic makeup of the populations that reside in the geographic locale that may or may not match who's receiving services and support overall. So again, this is could be much lengthier, much more detailed. This is what I pulled together for this particular webinar to get us to really begin to think about that relationship between person-centered thinking, planning, and practice, and cultural competence. Next slide. As we think about the individual, the person, I think it's very important for us to look at the various roles that individuals may indeed play within your organization's programs and systems. We know that individuals may indeed serve as advocates, and I want you to really think about what does that mean in terms of person-centered thinking and practice, that we're looking at partnerships across the board for individuals at the individual level. What can individuals bring to the partnerships so that we're not always looking at outreach, but we're looking at engagement, which looks at the reciprocity that between organizations and communities served. We know that, again, people who may be aging, have disabilities, who have mental health needs, can indeed be just great informers on our advisory groups. We know that individuals who are aging, have mental health needs and or disabilities can indeed and should be on the board of many organizations. Coming from a University Center for Excellence in Developmental Disabilities, I'm very conscious that individuals with mental health needs, those who may be aging and or who have disabilities, can serve as faculty, program staff and consultants. They do not always have to be, quote, the recipients of services and supports. And lastly, we should really look at the individual as a knowledge beacon. They know their culture. They know, and they can teach us so many things if we're open and willing to really think about changing our practice. Because this is about us. It is about changing the culture of how we deliver aging, mental health, and developmental disability services. Next slide. Okay, those were my summary remarks. Thank you.
Thank you so much, Dora.
Yes, thank you, Laura.
I am a little echoey. Okay. Hopefully we can adjust an echo that comes on my end. We have a few more minutes, questions and answers. And as usual, the Q&A text has been rich and full of questions. I'm pleased to see that our panelists have been answering some questions on chat, which is great. But there are a few that I'd like to hold up that I think I'd love to hear, all of our panelists speak to. The first is, what was one of our first questions? What is your practice in finding cultural informants, meaning members of a cultural group who teach others, who can speak into your organization so that you better understand their values, beliefs, and priorities? So if you could each speak a little bit about cultural informants and whether and how you might engage them.
I'll say this really very quickly, and I think Lorraine brought this up, as did Brenda and Diana. Language is very important. And in certain communities, the word informant is not a positive thing. So consider just reframing that to cultural brokers. And cultural brokers are individuals that may know a lot about a particular community, and they can serve as an intermediary or broker for organizations that need to increase that knowledge. And I'll stop and.
Well, this is Diana, and I just want to say that we have a lot of different ways that we work with people from different cultural backgrounds and communities. In addition to having a very diverse staff that is very representative of our state across all of the different types of culture that goes into the definition of cultural competence. We also have parent leaders and volunteers that reflect that diversity, and we work with many, many, many community-based organizations and other types of organizations, immigrant organizations, the organizations that serve the lesbian, gay, bisexual, transgender questioning community, etc. So that, and also then with kind of community leaders from different communities who have the respect from people from their community, from their cultural background, etc. So we have a lot of different strategies that we use to try to make sure that we have the community knowledge and community acceptance and the ability to provide supports in the ways that families from various cultural backgrounds can benefit from.
Great, thank you, Diana. Would any other the panelists like to speak about cultural practitioners, cultural informants engaging in this way? If not, I can. I'll go to a next one. Someone chatted in. I've heard the term cultural humility used a few times. To note that I will never know what it is like to be from another culture, no matter how much I might wish to be culturally competent. Wonder if there are folks on the panel who'd like to expand a little more about the concept of cultural humility and how you might use that in your organizations.
All right, I'll share this really very quickly because I think people don't know the origin of the term. So cultural humility was, this whole concept was created by a colleague, Melanie Turvalon, who's a physician, and her colleague, Jan Garcia. And it was really created within the context of medical education. And they felt as they were receiving their medical training that it didn't put a lot of emphasis on physicians needing to be more humble and to be able to learn from their patients and the communities that they're serving. I think that that many people like that term. I think that it resonates with many people. I also know that if we look at legislation and other things, the term cultural competence is there. Cultural competence is not about being competent in everyone else's culture. It really is about knowledge and skill sets and a systematic way to take culture into consideration in the design and delivery of services supports. And part of that self-assessment and knowing yourself is the capacity to be humble. And so again, there are many different terms that are out there. I'm comfortable with the term cultural competence, but I do think that people have to decide what's, quote, comfortable for them and what works within their organization.
Any other panelists like to speak to this concept of cultural humility? Okay. I think we have time for one more question. Can you expand on the importance of seeking to discover and understand a person's worldview? It seems to be at the center of a person and therefore at the center of person-centered care.
Can you ask that again, please?
Yeah, sure. Can you expand on the importance of seeking to discover and understand a person's worldview? It seems to be at the center of a person and therefore at the center of person-centered care. How might someone engaged in person-centered practice engage with a person to understand their worldview?
Well, I'm just going to briefly say that, as I mentioned, we strongly believe that both person-centeredness and cultural competence are about relationships, and relationships involve learning about oneself and sharing about oneself as well as learning about others. And one of the things that is really critical is to ask people what works for them in terms of developing a relationship. People know a lot about themselves and what works for them in terms of getting services and being engaged, and having respect for people's knowledge about what works for them and being genuinely interested in learning about that is really, I think, at the heart of being able to develop the respectful relationships that will benefit the people that we're trying to serve to the greatest degree.
Great. Thank you for that, Diana. Wow, so much covered in the past almost 90 minutes. We have nothing but heartfelt thanks for the 5 amazing panelists who have shared their practices, and thank you for this discussion. Just a couple of housekeeping notes. We will post a recording of this webinar, PDF versions of the final slides, a Spanish language transcript, a plain language summary, and also some kind of resource document in response to some of the questions that we couldn't get to on our website in about 2 weeks. Our website is ncaps.acl.gov. And please also visit that website and download the rich materials that were created from July's webinar, which was really focused first on culture and really laid the groundwork for this discussion, and will lay the groundwork for the discussions of the next 2 webinars, which Tamara mentioned. The next one will be on language, etc. Can we go one slide back? Before we pull up, sorry, one more. Before we pull up the evaluation questions, I also want to put in a plug for our November webinar. The registration is open now. I'm putting the link into chat right now. It is on trauma-informed person-centered thinking and support, another key intersection that we need to be thinking about as we engage in person-centered practices. So please do register for that webinar. The link will also be up on our website very soon, and we'll be sending out an email blast as well. So finally, we'd like to just pull up our real-time evaluation questions. There are 7 questions. Please take a moment to let us know how the webinar worked for you. We really do use these data to inform our NCAPS webinars from month to month, and we value your feedback. And one final big thank you to our presenters, Tawara, Bren, Christy, Diana, and Lorraine. And thank you to the over 1,000 people who joined this webinar. It's wonderful being in community with you and having some discussions, and we hope to continue that as we move on. So take care, everyone, and we will see you on November 18th.
Thank you, everyone. We'll be leaving the poll questions up for just a little bit so that people have a chance to scroll through all of the questions and go ahead and answer them. And thank you, everyone. And at this point, we'll close up the webinar. We really appreciate everyone's participation again, and we look forward to seeing you in the future.